Welcome to Pet Health Unpacked, the show where we explore the science that helps our animal companions live, better lives. I'm your host, Ben Carter.
And I'm Dr. Anya Sharma. It's a real pleasure to be here.
Anya, let's dive right into a topic that I know so many pet owners can relate to. The mystery of the endlessly itchy pet. You see your dog or cat scratching constantly.
Right.
You've ruled out fleas, and then you start to wonder, could it be their food?
That's a very common pathway, Ben. We call the skin-related signs of a food allergy a cutaneous adverse food reaction, or CAFR. And the symptoms, they aren't just itching.
Okay.
They can include things like recurrent ear infections, skin infections, really just overall misery for the pet. As veterinarians, our gold standard tool for diagnosis has, it's always been the elimination diet trial.
Right, and that's where things get so tricky for owners. You have to feed your pet a special and often expensive diet with absolutely no other treats or scraps.
Right.
But for how long? I feel like the advice on that has always been a little bit vague.
You've absolutely hit on a major historical challenge in veterinary dermatology. For years, the recommendation was just this huge range, anywhere from 3 to 12 weeks. And that uncertainty is so frustrating for everyone.
Wow.
It's just so hard for owners to maintain a perfectly strict diet for their pet without a clear finish line in sight.
So what changed? Is there more clarity now?
There is, thanks to a landmark systematic review published in BMC Veterinary Research. Now, think of a systematic review as a study of studies. The researchers didn't just look at one group of animals.
Okay.
They gathered and analyzed 25 years of published data. It's a really powerful way to find a reliable answer.
So it's like they're assembling a giant puzzle using pieces from dozens of smaller puzzles.
Exactly.
To see the bigger picture. So what did this big picture show them about these diet trials?
The picture was remarkably clear. The researchers, they were able to create a timeline of symptom improvement. They found that for dogs, a 5-week trial was long enough to see a major improvement in about 85% of cases. And for cats, it took around 6 weeks to see a similar remission in 80% of them.
That's already so much more specific than any advice I've ever heard. But 85% isn't 100%.
Right.
What about those other pets?
And that's the crucial takeaway from the paper. The researchers asked, what's the optimal duration for the highest sensitivity? Well, they found that extending the trial to 8 weeks pushes the diagnostic success rate to over 90% in both dogs and cats.
Wow, so 8 weeks is the magic number.
It's the evidence-based magic number. It allows a veterinarian to say with a high degree of confidence, if we have seen no improvement after an 8-week, 100% strict diet, it is extremely unlikely a food allergy is the primary cause of your pet's itching. It gives us a clear diagnostic checkpoint.
The impact of that just feels enormous. It's not just some academic number.
No, not at all.
It completely changes the conversation in the exam room. It gives owners a concrete goal, which has to make them more likely to actually succeed with the trial.
Absolutely. Compliance is the single biggest factor in a successful trial. So when I can give an owner a clear, evidence-backed timeline, they feel more empowered and more motivated. We're a team working towards a definitive goal. And after that 8-week period, if the pet's symptoms are gone, then we can begin the provocation phase, reintroducing single ingredients one by one to find the specific trigger.
So this one piece of research provides the solid foundation for the entire diagnostic process. It's incredible to think about the thousands of itchy pets around the world that can now get a faster, more accurate diagnosis just because of this work.
Exactly. It's a perfect example of how clinical research directly translates into better care, less frustration for owners, and most importantly, real relief for our patients.
It truly is. Well, that's all the time we have for today. A huge thank you to Dr. Anya Sharma for unpacking the science for us.
My pleasure, Ben.
Now, here's a question we'd like you to think about. Knowing that a successful food trial demands 100% strictness from everyone in the house, what creative strategies could a family use to ensure everyone, including kids, friends, and family, sticks to the plan and doesn't sneak the pet a forbidden treat?